So there's lots of different ways to do breast reductions. I'll tell you about the most common ways we do them here in the United States, and at the end I'll tell you some of the non-common ways that you'll hear about online. So there's really two pieces of information that will give you an idea of what type of breast reduction. And that's going to be information about the pedicle and information about the incision. So the pedicle is what we call the tissue that's left behind. This is the piece of tissue that your nipple is going to live on and get its blood supply. And so how the pedicle is attached to your body is really how we name it. So if the pedicle is attached at the lower portion of your breast, right in the middle, we call that an inferior pedicle. If it's attached in the upper portion, central in your chest, we call that a superior medial pedicle. Those are going to be the most common pedicles that you see in the United States. Both of them are great options. Now, when it comes to incisions, the most common incisions you'll see in the United States are going to be a vertical pattern, also called a lollipop, or a wise pattern, which is also called an anchor pattern. So a lollipop incision is an incision in a circle around the areola and then straight up and down. A wise pattern incision is going to be an anchor pattern, so it's a circle around the areola, straight up and down, and then an incision in the crease, so it looks like an anchor. Both of these are great options as well, and all of them can give good results. You just really should always go with what your surgeon is comfortable with and what they recommend. I do most of my breast reductions with a vertical pattern incision, but I do occasionally have patients where I do an anchor pattern, and that's usually someone who wants a really big reduction, has really large breasts, or has really low breasts. You often need that incision in the crease in order to get the best possible shape. So if you read about breast reductions online, you will read about the nipple being removed and put back on. And that's just not something that's commonly done. That's called a free nipple graft, where your nipple is actually removed from your body and put back on as a skin graft. That's not something, again, that's commonly done. Your surgeon almost certainly will not do this in your breast reduction, but it's always a good idea to ask. Some of the more rare types of breast reduction that you'll also see is going to be a liposuction only breast reduction. I've done videos on this before. It's a great option for patients who just want a small reduction and their breasts aren't horribly droopy. You'll also see some discussion of different types of incisions, breast reductions that are done through an incision that's a circle around the areola and then just a big incision in the crease. Not as commonly done, but certainly an option as well. And then sometimes you'll even see a breast reduction that's done through an incision around the areola alone. This is usually not something that's possible unless it's a really small reduction and you don't need much lift at all. And there's lots of other types of breast reductions as well, with different pedicles and different interesting ways of doing them. So always ask your surgeon what type of breast reduction they recommend. Again, they all give beautiful results. It's just always important to go with what your surgeon's comfortable with and what they think is the best option for you.